All right, Nuri, what brought you to Rasmussen? I heard why you chose the MA, so what brought you to Rasmussen?
So yeah, I was in like Valley, and then I heard like people didn't recommend Career College, and my wife, she attended it.
Oh.
She said it was really good. So
Okay. Now, is MA a stepping stone for you into nursing as well?
well, at first I was like considering that, but
Sure.
now like I kind of like medical assistant, like what it does.
Okay.
Hopefully,
Yeah.
I continue, but I'm okay if I see it.
Okay. Nothing wrong with that. Nothing wrong with that. All right. Shane, I heard why you chose MA, but what brought you to Rasmussen?
I had a choice between Rock Valley and Rasmussen. I preferred that was in English.
Okay.
It
Wasn't
wasn't even
in a mix for you.
No.
Okay.
I actually was brought over from my career planner.
Okay.
From Chrysler.
Okay.
Right, so I bet, and MA is actually more of a
Perfect. So do you still actively work for Chrysler?
No.
Okay. Okay. I've had some other students that were Chrysler employees and did the same thing, did the buyout. And they actually just graduated a couple quarters back. Great people. So awesome. Well, that's you guys. So a little bit about me, my backstory. If you obviously were in live lecture yesterday, you heard me say this, but I started with OSF in 2009, and then I've worked for them ever since. So when I went to leave to come here, I gave my manager my 2-week notice. This is my 2-week notice. She goes, how about you stay PRN? And I went, no, this is my 2-week notice. And she goes, how about you stay PRN? And after the third time of her saying it, I gave up and I said, fine. So I still actively work for OSF. So if you're looking at me and you're like, God, she looks familiar, probably why. I worked for Northwestern Memorial before that for 2 years while I finished up my degree in Chicago, which is where I went to school. And then I got a message actually from my accrediting bureau said, hey, Rasmussen's looking for MAs to teach. And I went, that sounds fun. At the time, I didn't have kids. I just had a dog and a husband, and that was all I needed. And I signed up. I did night classes. I started that in 2012. In 2018, the program coordinator left, and they said, hey, do you want that job? And I went, yes, I do. So I have been with Rasmussen since 2012, but took over the program coordinator position in 2018. And I've been doing this ever since. So unfortunately, this is the face that you're going to see the whole time you're here. I wish I could say that there's another person that's going to come in. There's not. It's just me. So I apologize in advance if this is not what you thought. And I apologize for the issues with the camera yesterday. Like I didn't have this one, and I was like, if I turn this on, it's gonna be all scratchy, and that's all they're gonna focus on. They're not gonna listen to a word that I say. And from the video I showed you guys, obviously this looks very different. This is much more open than those like crowded tables in the middle. So I like this better. This room is supposed to hold 20 students. That's my cap. And I looked at those tables and I went, well, that's not gonna work. So I switched to these guys, and we're still not quite at 20, but I don't have that problem yet. So when I have that problem, then I'll cross that bridge. Each week when you do come in, one of the things I like to do is have sort of the setup for you guys. So I'll always have an agenda on one side of the board of what we're gonna be doing. And then on the opposite side of the board, I'll have the hands-on competencies that you're gonna sign off on. We're not gonna do any today, which is why that side is blank, but at least you'll have an idea of kind of what our day is gonna entail. And like I said yesterday, the first day is really doing a lot of like this is how class looks kind of schmutz. And then as we kind of weeks go on, we're gonna start doing more hands-on. We're gonna just get into it really deep, okay? So I gave you guys all of the paperwork that you're gonna need for today. And one of the things that I like to do is print everything for you. I don't always know if you guys have a printer at home, or if you're like me, I have a printer that never has ink, ever, which is weird because my husband and I don't use it, so I don't understand how it doesn't ever have ink, but it doesn't. So I always just kind of have all of that stuff for you, so you will never have to print anything prior to coming to class. I'll always have it for you guys, okay? So again, this is the breakdown of what we're gonna do. We're gonna start the first half of the class, and I apologize, I gotta adjust the camera a little bit. The first half of the class is really gonna be going over sort of the pieces of the course that are gonna be important for you guys. I gave all of you a folder. It's got your name on it. The reason I do this is every week when we have things to turn in, you're gonna put it in here. Your skills log, when we talk about that, it's gonna go in here. That way you guys don't lose it. It doesn't get lost. It doesn't, you have kids, so it doesn't get like colored on by kids. It doesn't get, coffee stained because you dropped your coffee on it before you left in the morning. So at the end of every day, you're gonna turn this in this black bin here. The other thing is that when I have things to hand back to you that are graded, they're not just sitting out on the desks for everybody to see your grade. I'll stick them inside. So that way we kind of keep that privacy. So anything that I hand out that is 2-hole punched is going to go back into this folder. Anything that is 3-hole punched or no hole punched, that's for you to keep. Don't give it back to me. I don't want it back. Okay. So we're going to start off with just sort of the basics right at the top with our course syllabus. You can either follow along on the PowerPoint or with the documents as we're going through them. So the first document that we are going over is your course syllabus. I printed a version for you, but there is the electronic version that you could look at as well. First thing that I always point out is that there are 2 numbers where you can reach me. My office number, so the 316 number, that is a landline number. You cannot text it. It goes nowhere. It ends up with no one. It just ends up in a blank void, and I have no idea what happened. Okay. But my Google Voice number, you can text that if you are going to be absent, you're running late, you've got questions with homework, and you don't want to wait for an email. You can send that text message there. The thing I will say to you is, I've said it a couple times, I have a toddler. So that like stretch from like 9 p.m. to whenever she decides that she's going to fall asleep now, which last night was 11:45. I don't really have my phone in there because if I have my phone, she's like, I watch. No, you don't. You go to sleep. Okay. So I do just ask that you give me at least 24 hours to reply to anything. Okay. If you text me prior to a class to tell me that you're going to be running late or that you're going to be absent, I will physically see it. I will not acknowledge it. And that's not against you guys. It's that I'm trying to get labs set up. That's what my focus is on. I'll always email you after class or respond after class and let you know that like, hey, I did get that. Thank you for letting me know. So this course is really built on helping you guys develop the skills that you're going to need to set your foundation of becoming a medical assistant. So we're going to learn things like vital signs. We're going to learn injections. We're going to learn blood draws. We're going to learn the laws and ethics. We're going to learn about teamwork and team building. We're going to have a lot of group activities where I have you guys working together and learning content together. And that's going to start today, the end of class. But it's really kind of setting that foundation for you guys. As you progress through the quarters and into the program a little bit further, that's where we're going to add a lot more content, a lot more hands-on, a lot like day 1 of clinical 2. I think you have like 7 hands-on competencies that you're doing. Like, so we went from, I'm going to hold your hand very nicely, and then I'm just going to kick you out of the nest like a baby bird next quarter. Okay. It is an 11-week course. It goes from now through March 15th. That is the end of the quarter. So right before St. Patrick's Day, you'll be done. You'll take a 2-week break, and then you'll come back the first week in April, do another 11 weeks, and so on and so forth. Okay. If it's the end of the week, I have talked way too much. If you have questions as I'm going through this, stop me, because I'm just going to keep talking. Because if I don't, I might fall down. Also, the tongue tie that you just saw happen wasn't enough. If I stop talking, it's going to get a heck of a lot worse. So one of the things that I will say is each course does have discussion boards to it. Our lab class is no different. So if you're looking at your, sorry, Alexa, I'm trying to fix the camera. There we go. if you're looking at your courses, you probably have two courses that look like they have very similar names. You have an MEA1350 and an MEA1350L. Well, the truth is one of those is lecture and one of those is lab. And a lot of students are like, oh, the L must be lecture. It's not. L in that case stands for lab, and that's our lab class. So our lab class does have some online pieces to it, but for the most part, it's obviously on campus. You will have some assignments that you have to do online, but a lot of everything that you're going to get graded on is going to happen here in the course. I just realized I don't think I ever hit record. Oh, no, I did. Okay. Pure panic just set into my body. So one of the things that we do is every week you are going to have a discussion board. That discussion board is going to present you with a scenario of a medical assistant and how they're interacting in their clinical setting. What you get to do is then depict how that patient's path or that MA's path looks. PATH stands for professionalism, attitude, time management, and hygiene. So you're going to look at that scenario and determine how is the medical assistant's professionalism? How is their attitude? How is their time management? How is their hygiene? And then comment and reflect on that. One of the things I will say is that you want to make sure you are addressing all 4 areas, even if something doesn't fit. And most of the time it's hygiene. There are some scenarios that we present that do give like a hygiene issue, but most of them do not. So just simply at the end of it say, hey, hygiene doesn't apply to this scenario, or time management doesn't apply to this scenario, whatever it might be. Normally, minus week 1 of this quarter, your initial discussion board is due on Tuesday. But because the class is opened on Tuesday this week, your initial post was due last night. So if you haven't done it, you do want to make sure that you do get that done either today or tomorrow. I have a set word requirement, so your initial posting should be at least 100 words. That just means that you're giving detail to your topic that you're talking about. And the reason I like you to give detail is because you've got to reply to somebody. And if you don't give that detail, there's nothing for them to reply to. That makes sense. I will always reply to at least one person every week. And if you reply to me, that's fantastic. I love that. I love that for you. But it doesn't count for your grade. You have to reply to a classmate. It's our way of getting you guys to interact with each other outside of the classroom and have that connection outside of the classroom. Reply posts to classmates are due on Saturdays by midnight. And then you want to make sure that it is at least 50 words in length. Questions on that? The only time that will be different is at the end of the quarter. That last week of classes, they end on Friday. So your initial post will be due on Tuesday, but your reply will be due on Friday. The nice thing is that I've already got the course calendar set up for the entire quarter. So you can look ahead for due dates and things of that nature and have all of that kind of in your back pocket. Some of the other things that we're going to do in this quarter is we are going to do a lot of in-class activities, which a lot of those are going to be group activities. We do have some outside assignments. Those are typically going to be like your mind tap assignments, and we're going to talk about what those are in a minute, as well as doing your immunization trackers, which we're going to set up today. Get that kind of out of the way for you. You do have a weekly PATH assignment, and I look at PATH as sort of your paycheck, right? If you go to work, you get paid, right? Well, if you come to class, you get paid, but you get paid with a grade. Does that make sense? That assignment is looking at your path, so your professionalism, your attitude, your time management, your hygiene, and me just kind of like looking at things and, hey, I saw this today, and you might want to work on that as an improvement. I will never, ever call you out in the middle of class, right? I'm not going to look at you and be like, you know, Nuri, you got to do this, or why aren't you in the right uniform, Rebecca? You know, I'm not going to do that. That's not me. Number one, nobody likes to be called out in the middle of anything. Okay. It's also going to change your attitude, right? If I call you out in class, you're all of a sudden going to get a really bad attitude, and nobody likes that. So instead, I just make comments on your path as a way for us to communicate about like things that I saw that week. Okay. And then at the end of the quarter, that last week, we will have a practical final exam. So it's going to be a hands-on competency exam. I'm not going to talk about it today because I am not going to overwhelm you with the fact that in 11 weeks, you're going to have a final. Nobody wants to talk about that right now. We do have a set grading policy. So for this course, and all of your MA core courses, you must pass them with a 73% or higher. If you do not pass with a 73% or higher, it's an automatic fail. And because the lab class and the lecture class go hand in hand, even though they're two separate classes, if you fail one, you fail both. So if you fail your lecture course, you'll also fail this course and have to repeat both of them, and vice versa. Okay. One of the things that I like to try to do is I try to make sure that I'm helping you stay on track. So every Monday, I go in and look at all of your courses, not just mine, but all of the ones that you're taking. I look at what your grade is. I look at your submissions of assignments, and I see if you need any help or kind of outreach. And then if I see that you're like missing assignments, I'm going to reach out to you and just be like, hey, just touching base. I saw that these assignments aren't turned in. That's my way of helping you get back on track. But also if there's something else that's going on that you need extra help with, that's my chance for us to have that communication. Okay. The goal is that I don't have to ever email anybody. The goal doesn't work, but I like that goal. Okay. There are 2 attendance policies that you as students who are attending residential campus classes have to attend to. So the first one is the on-campus attendance. You are only allowed to miss 8 hours of your clinical lab, so it's 2 class periods. Now, I understand that things happen. Kids get sick, we get sick. It's winter. We've got winter storms that are coming, cars break down, we've got ice issues. Listen, I know things happen, right? I've seen where people have been like, I have a court date on this day and I can't change it. You're absolutely right, you can't. So if you can provide documentation for your absence, right? A doctor's note, a court case note, if you get to where you have to have your car towed or something of that nature, showing me just that proof that that's really what happened will eradicate those 4 hours. The only things that I really don't allow as like excusable things is, well, I have to work today. We only meet once a week, so hopefully you've worked with your employers. You work from home, so you have the easy one. But hopefully we've worked with employers to know that like Thursdays, I have to be off at least in the mornings, okay? The other attendance policy is the online attendance policy. If you go inactive for 14 days, they will automatically kick you out of the course, okay? Which is why I also like to touch base on Mondays. So if I see that that has happened, I can get you back into a course so we don't run into that issue. We have a late assignment policy that states you have 7 days after an assignment is due to submit it for grading. But for every day it is late, we do lose 10%, or we do deduct 10% off of that. So by Friday, which is 5 days after assignments are due, your assignment, you could have gotten 100% on it, but you're only going to get 50%. Again, also why I like to catch you on Mondays to try to help kind of combat that. And then our academic integrity policy is pretty much like, don't cheat. Don't think that I won't find out about it. My favorite story of this is I had students that used to sit back to back. And student A turned in her assignment. I graded it, gave it back to her. Student B turned in student A's graded assignment, like with my comments and everything. And then told me the Wi-Fi did it. I was like, I don't know how stupid you think I am. No. And at that time I had like super blonde hair. It's like, listen, I'm blonde, but I'm not dumb. That's not how that works. So if you're going to cheat, do it smartly, but don't do it at all. Make sense? Do you guys have questions on the syllabus? Okay. In your packet of fun, you have something that is called a syllabus acknowledgement of a syllabus content form. We're going to have you fill that out. It does need to be filled out in blue or black ink. So if you do not have a blue or black ink pen, let me know. I can provide you with one. The top line is what you're going to put your name. So it says I'm just going to say my name because it makes it easier. I, Carissa Legg, have read and understand the course syllabus for. I filled this in for you. It's MEA1350L because the actual name of the course is Fundamentals of Clinical Laboratory Techniques. That does not fit on that line. I've tried. It's taught here at the Rasmussen University Rockford campus, and it's taught by myself, and I put my name in there already because nobody spells my name right. Couple of things that are really important are keeping our laboratory safety. So obviously, this is where you're going to spend the next year of your life. I wish it was cooler. I've tried. I keep trying for a new room. They keep telling me no, but this is your home for the next year. So we obviously want to make sure that we are keeping it safe, not only for you, but other students, and same thing for them. I have classes on Tuesdays and Wednesdays, so those classes have to keep the room safe for you guys when you come on Thursday. One of the things that we do recommend and follow is universal precautions, which means that everybody will be provided with and wear protective equipment when we're doing certain things: gloves, gowns, masks, shoe covers, all of that to protect us from blood and other bodily fluids. If there is an exposure, so something happens and you end up with an accidental needle stick, we do have a policy in place to help you guys with that. The other thing that with exposure control, I've seen or we've experienced here is if a student has a seizure in the middle of class and somebody gets injured in the process of that. Obviously, we don't want that to happen, but we can't control if somebody has a seizure disorder and a chair gets thrown while we're trying to help that other person, okay? We do have instructional practice controls, and really what that means is that when we go to do things, I'm going to show you, then you're going to essentially do a playback. So it's a watch, and then do. And the reason that we do that is to not only teach you how to do those things, but do them in the safest manner, okay? We do have personal protective equipment. So we have gloves of all sizes from extra small to extra large. Next to the sink there, I do have small, extra small, small, medium, and large. Same thing over here with the phlebotomy station. I don't have extra large out. I've never had to use them. I don't know why I have 70 boxes of them. They're just hanging out, but I do have them. So if anyone needs those, I will always make sure that they're out for those people. We also have in cabinet 7, we have gowns, shoe covers, hair caps, and masks. So if you want any of those things, all you have to do is simply ask us. Aseptic practices, that means that we are making sure we're washing our hands after procedures. If you don't want to do a full hand wash, if you notice all of the tables have hand sanitizer on them, so we can have you hand sanitize. The station right behind Nuri, which is not actually set up because we're not going to use it today, but is our injection station. There is a hand sanitizer there, as well as our phlebotomy station has hand sanitizer on it. So we've got all of those techniques in place to help you. About 5 times a day, you're going to hear that in the 4 hours that you're here. So I apologize. I've learned to block it out, but I always notice when it's happening because everyone's like, I've also kept the window shades down for a couple of reasons. In the summertime, it gets super hot in here because the sun comes right in. But also we've seen one too many birds or geese fly directly into the window. I will stare out the window all day. So I'm like a kid with a shiny object. I will stare at it if it's available for me to look at. So that's why they're also closed. Also, for whatever reason, if they're open and it's raining or snowing, people feel the need to tell me that it's raining or snowing. I don't really care. I'm not physically out there. I don't care what it's doing, okay? We do have some things that are excluded from the lab. It is specifically relating to eating or drinking in here. Reason being, number one, I used to let students bring in water bottles, right? We used to do 6-hour labs. So that was a really long day to not have water. Except I had a student who ruined that for everybody because she brought a water bottle that did not have water in it. I'll let you do the math there. So they ruined it for you. But if at any point in time you do need to take a drink of water, you have a water bottle with you, You can step out in the hall, take a drink, come right back. If you've got blood sugar issues, so you have potential of drops going low and you need to keep candy with you, please do, because while I can help you, I don't know that it's happening. So if you need to have those things, absolutely keep them with you. We also we ask, and this is more for ladies, but I guess it's for everybody, no applying makeup or lip balms in the lab. The whole point of that is because we deal with blood and bodily fluids, so there's a lot of biohazard materials in the air. And while we clean the tables and surfaces, I can't guarantee that those things aren't still like hanging out in the air. So you don't want to have obviously an open container near your mouth. We also ask that if you wear contacts, you put them in before you come to class. And God, I would hope you did, because how did you drive here without them? That's all I think every time I have to say that. How did you drive without your eyeballs? So I want to know. If something happens and a contact pops out in the middle of class, then that's a different situation, but don't like actively put them in class, okay? We do have some housekeeping. So at the end of every day, I ask that you push into your chair, right? And I also ask that you wipe down the station that you're working at. So all of the tables also have cavi wipes on them. All I ask is that you put on a glove or a pair of gloves and wipe down the table. You don't want to touch those with your bare hands, okay? If something happens and you get injured here, the first course of action is to tell me. We'll fill out an incident report, and then depending on severity, I may have you go to one of our clinical sites to be examined. And then this is always a fun one. Can anyone locate the first aid kit? I don't want to look at it, because if I look at it, you're gonna know. Yeah, it's right above the sink. Okay. Now, the other thing is that behind Nuri are Band-Aids, alcohol, and gauze. And then over here on the phlebotomy station as well, we have gauze, alcohol, and bandages. So there are places that you can find first aid supplies without actually going directly to the box, but it is there. In the back corner, you notice that there is a red, white, and blue binder. Those are our Rasmussen University manuals, safety manuals, as well as maintenance logs and things like that. So I'm going to have you initial, if you haven't already done so, your initials. The last part says that we have gone over the syllabus, and the biggest thing is that you're claiming responsibility for your own education. While I am your instructor, I am your leader, I am your guide, and I can give you all of the information. If you're not willing to pick it up and work with it, that's on you, okay? I can lead a horse to water, but I cannot make it drink. And that's the theory I live by. Okay, you agree to all of that. You're going to sign the bottom. Today is January 4th, 2024. And it is 2-hole punch, so that's going to go into your folder, and you'll turn that in at the end of the day. All right, the next thing that we're going to talk about is your skills log. So that is this guy here. It is also 2-hole punch, so this is going to stay in your folder every week when you leave. First and foremost, please write your name on the top of it. While it's going to be in your folder, and it won't obviously leave your folder until the end of the quarter, when I have to send them to you later at the end of the quarter, I don't know who they belong to. So this is essentially what I like to coin your Bible. Whether you believe in a God or not, this is how you're going to get to pass on to the next course. So that's why I call it your Bible. This is your get out of quarter one card, okay? These are all the skills and hands-on competencies that we're going to work on over the next 11 weeks. So the first thing that you notice is it's got 10 vital signs. I think the 10th is on the back. We are going to at least try to get 5 of those, right? Just about half. And really, we're going to be working with height, weight, blood pressure, pulse, temperature, respiration, SpO2, and that is oxygenation level. So we're going to learn all of those and start doing them hands-on, okay? The only ones that count are the ones that you do here in class that I physically see. If you want to practice at home with your family, that's fantastic. I encourage you to do so, whether it's with friends, family, coworkers, whatever that might be. But unfortunately, if you are not here on campus with me, I can't verify that you're doing those. So we want to make sure that it's whatever you're doing here in front of class with me. The next section is hand washing and gloving. Such a fun week when I get to watch you guys wash your hands. Not once, but twice. So exciting, guys. So exciting. We learn how to put on gloves that are non-sterile and sterile. That one is actually kind of fun. Section 3 is surgical instruments and tray setup. That's where we're going to learn how to identify instruments. We're going to sanitize them. We're going to disinfect them. We're going to wrap them up for autoclaving, and we're going to actually autoclave them, which is sterilizing them. And then I'm going to show you how to set up minor surgery or minor procedure trays. So when you are doing minor surgeries with your providers in the office, know what that looks like. That's a pretty exciting week. We also have suture and staple removals. Everybody loves that. I don't know what it is. But when I say, okay, we're going to learn how to remove sutures and staples, they're like, yes. On who? And I'm like, nobody. There's dummy bodies for that. Yes, psychos. We're also going to look at and learn how to do wound care and wound care cultures. Everyone really likes that one as well. Pharmacology week is the week that you either learn that you like me or you hate this altogether, because there's one of two people. You either love math or you hate it. There is no gray area in between, okay? But I try to make it as fun as I possibly can. We're going to learn how to write scripts that are both for narcotic medications and non-narcotic medications. We're going to learn how to withdraw from ampules. We're going to learn how to reconstitute powder medications. So you take a powder, you make it a liquid, and then you can inject it. That's a fun week. And then how to do like oral medication passes, dose calculations, things like that. That is a rough week. I look forward to not teaching it every quarter, but I have to. They tell me by law I have to. So when that week is coming up, I will let you guys know, so that way you cannot hate me so much, because I did warn you. And then we get into the meat and potatoes of what we're going to be doing. We're going to learn intramuscular deltoid injections. It also gives us the option to learn Z-tracks and gluteals. I'm not going to teach them this quarter. Those are optional. So we are going to just start off very slow. We're going to learn intramuscular deltoid injections. We're going to learn subcutaneous injections and intradermal injections. Yes, we give them to one another, and it is just sterile water. It will not hurt you. Okay. The only thing that's going to hurt you is obviously I'm asking you to take at least one needle stick every week. But again, I will let you know when those are coming out. We'll learn how to do capillary punctures, which are finger sticks. So we'll learn how to do like finger stick glucoses. So that's, people tend to really like that week. Because with it, we're also then learning blood draw. So we'll be learning how to do venipuncture with the evacuated tube method and the butterfly method for this quarter. We will learn the syringe method in a future class. The last couple of things on your skills log are documenting a patient interview. So that is essentially rooming a patient, going through that process of start to finish of what your job as an MA would look like. We also have immunizations, so your immunization trackers that are going to be required by the end of this quarter. For this quarter, it is the hepatitis B series. It's really only the first 2 of 3, but if you have all 3, we're going to knock those all out together. The 2 varicellas, and then if you have your 2 COVID vaccinations and a flu shot. Flu shot we can wait on until a later quarter, but if you have it, you might as well, again, knock it out of the park right now. You will take a first aid and CPR class. Has anybody taken first aid and CPR before? 1. Okay, that's okay. We pay for it. You're going to go to that. It's a fun day. You're going to love it. The teacher's a little eccentric. It's not me. But I like her. She's fun. She's fun stuff. But by the end of that, you'll obviously leave with first aid and CPR. And that will carry you all the way through the end of your program, as well as into your externship. So that's pretty exciting stuff. Your MindTap simulation labs are on here. You have to pass those with a 73% or higher in order to successfully pass the course. And then your practical final exam is on here as well. So this Bible of fun is what these are what we're gonna be working on for the next 11 weeks. And it seems like a lot right now, but trust me, it's gonna go super fast. Once we get started in it, like next week, I think we take off 2 complete sections right off the bat. And it's like, whoa, okay, that happened really fast. But again, that's what happens that's what happens when you're having fun. You're like, no, it's not, Corey, stop it. All right. The next thing that we have is the instructions for doing your lab notebooks. I'm almost guaranteeing that nobody did it today, and that is okay. Do not go to a panic mode. So with the lab notebook, it is your way of creating a study guide for yourself from weeks 1 to week 11. You're going to be taking notes on things that happen in this lab, obviously, as we go through things. The lab class itself that's online, so any of the videos that I post, any of the content that I post, as well as your lecture. One of the things I always suggest to students is really what you should be taking notes on are the chapters that you have to do for MindTap activities. And the reason that is that's the content we're going over. So for module 1, you have 3 chapters that we're looking at, chapters 1, chapter 2, and chapter 4. For next week, it's 2 chapters. Now, I always try to have you guys do your lab notebook before you come to class. And the reason is that's going to help you be prepared for what we're doing in class. Okay. I will look at it at the end of the day every week just to see that you guys are actually doing your lab notebooks. I don't care if the lab notebook is a physical notebook that you're writing in. I don't care if it's a document that you're doing just on like a Google Docs and you're typing it up because you don't like writing. There's also a space in our Teams folder for you to do your lab notebook in there. I don't care in what venue you do it. I care that you do it, okay? But it's essentially your way of creating that study guide for yourself. It's your way to prepare for the lab class coming in at the end of the week. Do you guys have questions about lab notebooks? Oh, you guys are so quiet. You'll break out of that. All right, so again, I'm almost under the guarantee that nobody has done that for this week, and that's okay. Next week when we meet, I will look at the lab notebooks for modules 1 and module 2. Okay, so don't panic if you don't have it done today. Next we have our path standards. So this sheet here. So these are the things that I'm going to be looking at when it comes to grading your path for the week. So for your professionalism, I look at if you're wearing the appropriate attire for class. So once you do receive your scrubs, that's what you should be wearing, right? The Rasmussen maroon scrubs, non-skid shoes. If you want to wear a lab jacket, like what I have on, or you have a North Face one on, I don't really care, right? I'm freezing 99.9% of the time, so you're always going to see me in a jacket, even in the summer. The other reason I do that is because I'm covering up my tattoos, which is another thing. I'm making sure that tattoos are covered as well as they can be. Your communication is professional, so we're not speaking in slang terms. We're not swearing, using profanity, or I catch myself when I get really, really tired. I start just like slurring my words and they don't make sense anymore. Sounds like I'm drunk, but I'm not. I'm just tired. So by the end of today, you'll start hearing that come out because this is the most I've talked in 2 weeks. So unless it was to a toddler to go, do you want that? Do you want that? Okay. If you guys don't know, but you literally speak in just tongues to them. I make sure that you are not using your cell phone in class to text or be on social media. Like we have 4 hours blocked out every week. Which seems like a lot of time when you're here, but in all actuality, 4 hours goes very fast, and we have a lot of content to cover in those 4 hours. So I want you to obviously stay focused while we're here. Attitude, I just look at, are you actively participating? Are you giving a negative attitude, a negative feedback? Are you treating everybody fairly? Things of that nature. Time management, are you coming to class on time? If I give you a break, are you coming back from that break on time? Are you using your class time well, or are you just sort of here but not here, if that makes sense? And then obviously I look for hygiene. I look, I can't necessarily always tell if somebody has showered, but I can smell if someone has showered. I lost my spidey sense when I gave birth to my daughter, but that 9 months when I was pregnant was real rough. Some people, you can tell right away. I make sure that you don't smell like cigarette smoke, heavy perfumes or colognes. Your hair is tied back if it's longer than your shoulder length, and no excessive jewelry. So those are the things that I'm looking for when it comes to PATH. One of the things I will say is the PATH assignment is a Microsoft Word document that you're going to type your answers into. One of the things I do ask is when you are typing a assignment for me in a Microsoft Word document like that, write your answers in a different color, red, green, blue, whatever it is. So your answer stands out from the questions that are there, okay? And that's just to help me at the end of the day, just so I can know where your answer begins and where the question ends, kind of thing. Does that make sense? You guys have any questions? Okay. Okay. Well, the next section, I'm going to have you guys, if you have your computers with you, go ahead and get those out. And you're going to go to a website called castlebranch.com. I know you guys are going to need the Wi-Fi password, so I'll wait till everybody gets theirs up and I will give it to you guys. All right, so if you've got it up and you're ready for it, the Wi-Fi password is Rasmussen with a capital R. So RASMUSSEN 1900. Rasmussen with a capital R 1900. And you're going to go to that castlebranch.com. When you get there, in the top right-hand corner, you will see something that says place order. Place order. You're going to click on that. And the code that you're going to type in is capital R, capital F, 73, lowercase I, lowercase m. That's going to ask you to start setting up your immunization tracker. You're going to have things that you're going to need to fill out as you're kind of going through them.
Okay.
Yeah.
Right now, I'm trying to get the Wi-Fi.
Oh, you're good.
Is that Rasmussen?
Yes. So Rasmussen with a capital R. I will not touch your sentence. And then 1900. You're looking good.
Are we just putting it in the package?
Yes, package code, yes. Yep. So you're gonna keep moving through that. You're gonna keep moving through that. I'm just gonna ask you a whole bunch of fun and exciting questions. And then when you get all the way to the end and your tracker is actually set up, it'll look like this. And I know it's a really blurry picture, but you'll get what we call our to-do list. So I'm gonna let you guys start filling that out. While you're doing that, I'm gonna grab a drink because I'm not gonna lie to myself. Talking too much. Yes, I will be right there, sir. Yep, so package code, capital R, capital F, 7, 3, lowercase I, lowercase n. I was going to say it's sweet precious time, but you are now in the process of starting that. And you probably already have a login for Castle Branch because you had to do your background check through them. So when you start this process, at some point it's going to ask you to log in. If you don't remember that, then you have to do that whole like, I forgot my password. One of the things I do recommend is writing down your username and password, because if you're anything like me, I don't know what they are. I just hit the save my password and pray that it saves my password. Yes, ma'am. Oh, yes, yes. Oh, yeah, that happens. It's really upset with us. There you go. You're welcome. Yeah, not my first time having to deal with that. It gets grumpy. Just gonna go take a peek and see what people are. Doing good. Almost to the end screen net. Like that. All right, does anybody have the screen that we're seeing up front? Okay. Got 2 head nods on that one. That's good. You like that? Compete. Oh, yeah, you're at that fun stage. I know that stage. You're nearing the end. No, I want you to finish. You're okay. You're just love to get all sorts of garbage. Okay. So, for the 2 of you that are there, you're almost there. You obviously can see that to-do list. And it's got some due dates on there. And the due dates are, they mean something, but they also don't. I don't want you to panic about them. If you have your records, by all means, upload everything. If you have all of your immunization records, you know you have all of this, by all means, go with God and upload them all. It actually makes a lot easier for you and for me, because then I know that you're ready to go. Do I care about everything that's in there right now? Absolutely not. I only really care about the hepatitis B and the varicellas. Those are the big things that we're going to focus on. The one thing I want you to, at this current time, ignore, it does not exist, you do not see it, you do not need to deal with it, is the 2-step TB test. It's there, we acknowledge it, we see her, we ignore her, okay? We're gonna worry about that in Q3, right before you go into your externship. Right now, it doesn't exist to you, okay? So when you have your records and you're ready to upload them, what you're gonna do, and of course you can't see it in the picture I have, are you there? I said it and then I realized that I don't wanna go too fast. Yeah, okay. So next to all of these is a little plus sign. You'll click on the plus sign and it'll give you the ability to upload a picture or a document. And that's what you're gonna do. When you finish and you hit that submit button, it will change the incomplete to pending. And once it has reviewed it, it will either say complete or reject it. We obviously want it to say complete. That's what we're going for. If it's rejected, it will always tell you why if you click on it. Sometimes it's things like, oh, the provider information is missing. So like it can't see the clinic, or your name is missing and it can't see that. Your picture is too blurry. And then sometimes they give me even more grief, but we're gonna go with the easy ones today. So, couple of things, couple of dates that are really important. Module 2, so that's Sunday, which is the 14th, January 14th. That's when your first immunization is due, that first hepatitis B, okay? Second due date is it's week 4. And that would be January 28th. That's when your first varicella is due. Module 7 is the next time. You're gonna have to bear with me because I don't really know. 4, 5, 6, 7. So that is February 18th. That's when your second hepatitis B is going to be due. And then in module 8, so February 25th, that's when your second varicella is going to be due. Those are the big due dates for you guys. So January 14th, January 20, no, is that right? 14th. Why did I just have a brain fart? 14th and 28th. There's a week in there. 14th and 28th of January, 18th and 25th of February. Those are your big dates, okay? Questions on these? Now, Rasmussen does pay for the hepatitis B series, so if you don't think that you would be able to find your records, or you didn't live in Illinois, or, you know, if you're like me, like I couldn't tell you where my records are to begin with. If you think you want to just start that series over again, all you have to do is let me know. I can print you an order form today and show you where you're going to go to have that done. If you want to take a look first and talk to me about it next week, that's fine too, okay? We'll work through that, but Rasmussen does pay for the hepatitis B series. So if you think that you want to start that again, or you know you need to start that again, just let me know and I'll get you that order form, okay? In weeks 2 through week 7, we are going to do some in-class activities and learn about all of these different injections that you're going to be doing. So starting next week, we'll have some group work on learning about hepatitis B, and then we'll kind of progress through and learn some of the other ones as well. Questions about that? Okay, so that's one thing off of our bucket list, because I know that I've gotten a couple of emails about immunization, so we now have our tracker set up. In those weeks that you have to turn something in, week 2, 4, 6, 7, and 8, while you turn them into Castle Branch, you also have to complete a part of it on the Blackboard Dropbox. What you want to do is take a screenshot of your Castle Branch showing those immunizations as complete. While it's really great if you want to send me your immunization records, that's not what I'm looking for. I'm looking for them being completed in here. And yes, I can see that they're completed in there, but you have to turn them in order for me to actually be able to grade that. Does that make sense? Okay. Next thing I want to talk about is MindTap. So I'm going to, if you guys would be so kind to get into your course with me. So this is obviously my end of the course, but I'm going to have you guys get into your course so we can kind of walk through this together. And you want to go into that MEA1350L, because remember the L is the lab course. And you're going to have to bear with me because I have to do this sideways. I'm going to fix that really quick. Be that nod of approval when you're in the course, just so that way guys. Yeah. Okay. All right. Nuri gave me her nod. Shane gave me his. I almost called you Sean. I know
It happens a lot.
I know too many
It's okay.
Seans. I know too many Seans. All booger beats. What's going on? Now it doesn't want to. Now it doesn't want to work. Okay. Number one, in order to get into MindTap, this makes absolutely no sense and is the one thing that is the biggest pain in my mind is how I have to tell students how to get into their MindTap activities. So the only way to access MindTap, awful, you have to go into one of the assignments. So if you go into the Module 1 folder, what we're looking for is anything that says like Chapter 1 Virtual Lab, Chapter 2 Virtual Lab, Chapter 4 Virtual Lab, or this Module 1 CMA exam prep. Okay, so you just click on one of them, and it should. Might take it a minute. For you guys, it looks a little bit different. For me, it automatically launches, but yours, it comes up as a side pocket, and then it says launch. Yes. Okay. Now I have to watch. So you actually need to do where it says click here. Makes no sense. Some of them I have to do that. Others of them it just goes right to it. So set back here. I can see all three of them. All right. So Rebecca, do you go by anything other than Rebecca's right?
No.
Okay. That's fine. Like for me, I prefer Corey. That's why I asked. Okay, so you guys are all in. You can close down what you're currently looking at. That's just showing you the book itself. And when you have that one that you're on, Nuri, you're going to go ahead and hit X on that as well. That's the actual assignment. You don't want to start that yet. Or maybe you do, but maybe you don't. You can skip that tour or start it if you want. Same thing. We'll close that off. That is your actual assignment there. Okay. I'm going to do the same thing. So a couple of things. Mine looks a little bit different than yours just because I get to see everyone's grades, but every one of these folders you can see has other pieces in it. So Module 1, it gives you a couple of flashcards to work on for education. Then you have your actual assignments. Here's the nice thing about the virtual assignments. Many of them are automatically graded. So you can take them as many times as your heart contends, right? As many times as you want. Doesn't bother me. I don't care if you do it 7 times or 8 times or 12 times or once. Because I don't have to grade these. Most of them. Unless it has a little M next to it, and then if you do 20, I'm going to be mad. Because then I have to manually grade it. Anything that has the orange dot that says counts towards a grade is obviously an assignment. And it will automatically go into your grade book. How you can access your grade book is on the left right-hand side here. You actually see where it says, like, well, for me, it says class average. And then if you go to the bottom and hit view grade book, it will bring up your grade book. So you can actually see what your grade is along the way. Again, you could take these as many times as you want. So you do the first attempt and you don't like your score, you can review it and do it again and get 100%. Okay. The other thing that's going to be really important for you guys is how do you access your e-textbook? Well, we're going to do it here in MindTap. If you look all the way to the right, you have all of these symbols. The fifth one down is your full book. It opens as a little side pocket, but then you can make it larger. And then you can go to your TOC, which is table of contents, and go to any chapter that you want. And you can read through it that way. Okay. Any questions on MindTap now that we've played with it a little bit? Yes, no, maybe a little? No? Okay. MindTap can be a little bit mind-numbing for students, and it can be a little bit overwhelming for students. As long as you are actively trying, again, you can go in and do these as many times as you want. If you start to notice that you're doing them and like the videos aren't playing, what you'll want to make sure that you do is next to your name up in the corner, hit that down arrow and then do a system check. Because sometimes what happens is your pop-ups are blocked. And if your pop-ups are blocked, that video is not going to play. So you want to obviously make sure you have all three green check marks. Okay. Okay. Any other questions about that? Okay, not hearing any. So the other thing I wanted to show you guys, and obviously Shane and Mary, I know that you guys have already accessed it. Do you know how to access your teams for the classroom?
Yes, I should. I was having issues with it last quarter, but I think it should be fine now.
Okay. So you should all, if you don't, I wish I had an answer for this. On the left-hand side of the course, you should have this open Microsoft Teams, and it should take you directly in there. The nice thing is that once you're in there, did it take you there? Or if you didn't click on it, it's okay. There is a folder with recordings. Oh, so you have to sign in. I'll let you do that. But the nice thing is that, again, anytime that you are absent, I'm going to record and save that, and it's going to be recorded in your Teams folder. So even if you were present, right, we went over a lot of material so far today. Maybe you leave here and you're like, my brain is shot. I have no idea what Corey said half the time. I'm going to go ahead and watch part of that video back. That's fine. Absolutely do that. Okay. Not going to hurt my feelings. Live lectures, if you're not able to attend them, all those recordings are going to be in there as well. And sometimes you watch the live lecture, you were there, but then you missed the code question, right? So then you have to go back and watch that, and that's fine. They're all going to be there for you. All right, feeling good? Do you guys have any questions on anything in the course that I can help you with right now?
I know you said you had a little video chat yesterday.
Yeah.
Is that supposed to be in here as well?
Yeah, it will be in your Teams folder. So we need to go into our actual team. So go to Teams for me. Taking this beautiful time. We love that for us. So we are this one here. And so the recordings, if you go into files, now that I said that, I don't know if that's what it is. Oh, I was right. There's a recordings folder. And so that's where that recording will be from yesterday. Yeah. You can play that at your own time. I hate listening to my own voice back, so I always can tell when a student's watching something I did. I'm like, I hear myself. It's awful. All right. I'm going to switch this back over to our PowerPoint. Actually, I'm going to freeze that for a minute because I got to get back to where I want to be for our PowerPoint. All right. So this is where we're at. We have done all of the schmutz and the fun up to this point. Now I'm going to stop talking for a few minutes, like 30 of them. So there are a couple of things that I want you to get out. So as we're going through this, you can kind of have them in the background. Number one, you do have your student handbook. I did give you a copy, a hard copy of what the individual on the screen is going to be talking about. I will say this, it is from an old, I don't know what she was called. The person over me. I don't know what her name is. Her name in here is Denise Poofall. It's not her name anymore. It's now Lindsay Nesmo. So other than that, all of the information is the same, but just not that same person. Also, at some point during this wonderful video, she stops a few times due to her dogs barking, her kids in her way, and it's always very interesting to me because I know when it's coming, and I always kind of cackle at it before it happens, and the students are like, "What's so funny?" And then the screen cuts out because she stops talking. So this is the first thing that you're going to get out, and then there is an assignment, and at the top of it, it says Module 1 Assignment MA Handbook, or MA Student Handbook. While you will turn this in electronically online, I'm giving it to you on hand so that way you can write your answers in as she's going over some of that information. Okay, so it is a two-sided sheet. There's 20 questions, but it's all going to be based about this orientation video. Uh-oh, you're giving me that face like you don't have it. So that's the first one. All right. So I'm going to get this started here. I'm going to make sure it is loud enough for everybody to hear. Yeah.
Hello, everyone. Welcome to the Medical Assisting Programmatic Orientation. My name is Denise Poofall, and I'm a department chair for the Medical Assisting Program.
That's what her title
I'm
is.
very excited that you chose this very rewarding career, and I wish you the best success as you track through our program. In the Medical Assisting Program, we have an MA Student Handbook. This handbook provides important programmatic information. It's also a supplement to the college catalog. The information all medical assistant students, policies and procedures in the medical assisting program at Rasmussen College are included. And each student must be sure to keep this handbook throughout his or her time at Rasmussen as a reference and a guide. You're also responsible for knowing, understanding, and adhering to the policies and information contained within this handbook. The mission statement, philosophy, goals, and accreditation information for the Rasmussen Medical Assisting Program. Rasmussen College Medical Assisting Program prepares our students to be active, productive medical assistants who practice, follow, and value medical assisting tasks and responsibility, safety, patient advocacy, high standards, aseptic technique, effective communication skills, and the American Association of Medical Assistant Code of Ethics. Our graduates are prepared to be members of high-functioning teams. They possess a high level of professionalism and use their critical thinking skills to adapt to change. We believe that communication, information literacy, critical thinking, interpersonal, and technical skills are the central tenets of a quality educational experience. Rasmussen College provides this through various educational experiences founded on a solid general and program core education. Medical assisting graduates will utilize team working skills, they'll make ethical decisions and actions. Our graduates will problem solve and demonstrate competence in the medical field, playing an intricate role and providing effective and efficient care supporting physicians and other allied healthcare teams. The goals of our program is that our objectives of the Medical Assisting Diploma Program prepare students to become valuable members of a healthcare team by supporting and assisting providers in delivering quality healthcare services. We prepare our students to ensure that they are proficient in cognitive, psychomotor, and effective learning behaviors for entry-level medical assisting positions. Our graduates will value and demonstrate critical thinking, effective communication, and medical ethics using diverse perspectives as they pertain to the medical assisting career. And our graduates will also be prepared to sit for a certified medical assisting exam through the AA-MA. Some of our goals include our students have the ability to perform clinical procedures such as they measure vital signs, CLIA wave laboratory testing, specimen collection, and other diagnostic and medical procedures, and effectively record all patient data into a medical record. They're able to recognize emergency situations and respond appropriately. They can apply legal and ethical practice, upholding the American Association of Medical Assisting Code of Ethics. They can perform general medical office procedures and medical billing. They have the knowledge in medical terminology, anatomy, and basic pathologies. And in addition, they're able to apply that knowledge through a system-based learning environment. They identify and utilize OSHA principles, standard and safety precautions. They can apply basic pharmacology concepts, which include dose calculations, drug interactions, interpretation of prescriptions, and medication administration. And they also value critical thinking, communication, diversity, technology, medical ethics, and information literacy. The Medical Assisting Diploma Program is programmatically accredited. Rasmussen College is regionally accredited in addition to our medical assisting program holding programmatic accreditation. Rasmussen College believes that ensuring our program is programmatically accredited is important to our graduates to obtain certifications that are needed in the field. This accreditation allows the graduates of our medical assisting diploma program to sit for that certification medical assisting exam through AA-MA. Rasmussen College offers the medical assisting diploma program at 19 campuses throughout the United States. Each of these campuses are accredited through APHES, which is the Accrediting Bureau of Health Education Schools. Please contact your program coordinator at your campus with any additional questions on your campus programmatic accreditation. What are the requirements to enter the MA program? The medical assisting program requires immunizations to be initiated at the start of fundamentals in clinical technique and will continue throughout their other laboratory classes. This is due to contact with bodily fluid and patient contact while in the classroom, as well as on the clinical externship. The immunization requirements for each residential laboratory course is outlined in the MA Student Handbook. Successfully completing the required immunizations by their specific deadline is required to pass and advance to the next clinical course. Please note that Rasmussen College will accept titers as proof of immunity for hepatitis B, MMR, and varicella. This is at the cost of the student. Students must also understand that if in the event immunity is not demonstrated within the titers, they will still need to obtain the immunizations and complete them within the time allotted for that particular course. Rasmussen College will not pay for the cost of any titers. Rasmussen does, however, cover the cost for students to obtain the following 2 immunization series. One is the hepatitis B series, which consists of 3 immunizations. And the second is a 2-step Mantoux series, also known as PPD. And again, Rasmussen College will cover that series of 2. The program coordinator at your campus can provide you with a proper voucher to receive these series at no charge to you with our assigned corporate partner clinics if you have not already received them and have proper documentation. The immunization schedule is as follows for the students and must be required within the designated courses. In fundamentals of clinical technique, students will receive 2 of the 3 hepatitis B immunizations. They will also receive both of the varicella immunizations if they have not already received them or have proven immunity. In clinical laboratory applications and diagnostic procedures 1 or 2, depending on their course sequence schedule, you'll need to receive your MMR, which is a series of 2, your tetanus and pertussis, and your 3rd hepatitis B immunization in that series. And again, Rasmussen College will cover that last hepatitis B series. Students also need to know that in the quarter prior to their externship, they will have to receive a 2-step MAD2, otherwise known as PPD. And again, Rasmussen College will cover the cost of this series, and your instructor or program coordinator will advise you when you need to obtain that 2-step MAD2. Also, please note that students may need to obtain influenza vaccine prior to starting their externship, depending on the time and the season of your externship. Drug tests may also be required by the site. These additional items and immunizations and tests will be the financial responsibility of the student. Background checks are also required for our medical assisting program. Students must pass a general background check and caregiver background check that is applicable in your state prior to admission. Students will then be required to complete another background check annually and the quarter prior to externship only should their background check expire during the time of their externship. Students will complete the background check process applicable within their state, and students will be advised on how to initiate the process. Passing the background check is at the discretion of each state based on their qualifications and not the college. Students must appeal to the state if their background check comes back negative and they are denied. If at any time during the program a student's background check is returned showing a possible issue, the student will be removed from the program until a clear background check can be obtained. The student must follow the appropriate appeal process to obtain a clear background check before continuing within the program. And now I'll share with you the program sequencing and grading policies. Regardless of status as a diploma or associate student, all students track through the diploma program first if they have not received the medical assisting diploma, either through Rasmussen or through a prior college. So once the diploma sequence is complete and the students are granted their diploma, they can then obviously be eligible to sit for their appropriate credentialing exam. And this exam then allows the student to gain employment and meet certification requirements that many healthcare facilities have in place. So if a student is dual enrolled in the medical assisting diploma and health science associate medical assisting specialization, he or she will begin the required general education courses to complete their associates only after completing the diploma program in which they are also dually enrolled in. The grading scale for the medical assisting program consists of the courses that are designated with an MEA and a few other MA core courses, including medical terminology, do have the following grading scale, and each syllabi in your course will provide you with a proper grading scale for that particular course. Please note that anything below a 73%, so 72 and below, in an MEA course or the other designated MA course core courses that require a 73 or above any student who scores a 72 or below will fail that course. If the student does not maintain a 73% or higher in all MEA courses, in addition to the other core medical assisting courses, and again, that is provided in the syllabi, he or she will receive an F in the course and will receive 2 additional attempts to pass the course. However, please note that medical assisting students are only given 2 attempts to successfully complete their externship and capstone courses. If a student does not successfully complete their capstone or externship within 2 attempts, they will be dismissed from the program. In the medical assisting program, we have skill development objectives. They can be referred to as competencies or assessments. So medical assisting students are required to show competence in multiple objectives throughout the MA program. Competencies and or assessments are listed within their applicable courses, and your instructor will review the competencies and assessments at the beginning of the course so you understand the expectations for that course. In Fundamentals of Clinical Technique and Clinical Laboratory Applications and Diagnostic Procedures 1 and 2, the following grading policies apply, and the students must achieve all of the following to successfully pass the above courses. 1, they must maintain a cumulative grade of 73% or higher. If the student does not maintain that 73%, the resulting grade will be an F and the student will fail the course. 2, the student must satisfactorily pass all clinical skill development objectives, otherwise known as competencies or assessments, with a grade of 73% or higher within 3 attempts. If at any one clinical skill development objective or competency assessment is not passed within the 3 attempts in that course with a 73% or higher, the resulting grade will be an F and the student will fail the course and the co-requisite course aligned with it. Third, the PATH project grading. Approximately 10% of the cumulative grade in fundamentals and clinical technique and clinical laboratory applications 1 and 2 apply for this PATH project. This PATH project is also considered a clinical skill development objective or assessment or competency in the fundamentals class and clinical technique and laboratory applications 1 and 2. All clinical skill development objectives must be passed with a 73% or higher, and this includes that PATH project. The PATH project is an 11-week project, and students only receive 1 attempt and must pass with a 73%. If a student does not pass the PATH project with a 73% or higher, they will fail the course and have to repeat the course in addition to the co-requisite course aligned to that residential lab. Students must also successfully pass the written and practical exam in clinical technique and clinical laboratory applications, diagnostic procedures 1 and 2 to proceed on to their externship. Students will have 2 attempts for each portion. Students must pass both the residential lab and the online lecture component of each course to proceed to the next one. Failure to do so will result in repeating both portions of said course. Please note that the fundamentals of clinical techniques does have a written and practical final exam. However, the score you receive in those 2 courses are calculated into your overall grade, and students will only have 1 attempt to complete this course, but as long as they maintain a 73% or higher in the course and pass all their competencies, their final exam, written and practical, are just factored into their overall grade. The PATH project projecting a professional and positive attitude is extremely important in working as a medical assistant. So we prepare students for a rigorous standard Standards of professionalism, Rasmussen College assigns the PATH project to all our medical assisting students. So PATH stands for professionalism, attitude, time management, and hygiene. The PATH project will be a project that all students, again, complete in the medical assisting program during the fundamentals and clinical technique and diagnostic laboratory courses. This is considered a course assessment, and again, students must complete it with a 73% or higher. Failure to do so will result in failing the course and the aligned co-requisite course assigned to it. Your instructor will explain how to complete this weekly assignment in your courses. The medical assisting program conduct, attendance, confidentiality, and student health and safety policies. Rasmussen College is committed to preparing students to be active, productive, and successful contributors to a global community. Our students, faculty, and staff of Rasmussen are expected to uphold the very highest business and personal ethics. Students of Rasmussen College commit to holding themselves and their peers to the foremost level of academic integrity and accept responsibility should behaviors and actions fall short of the college's expectations. Please review Rasmussen College Academic Integrity Policy located in your handbook. Should you have any questions, please reach out to your program coordinator, instructors, or academic dean on your campus. For conduct dismissal, students are expected to conduct themselves within the same standards of behaviors as they are expected in the workplace and in the community at large. Consequently, the following is an all-encompassing policy regarding students' conduct. The college reserves the right to suspend or terminate any student whose conduct is detrimental to the educational environment. This includes, but is not limited to, conduct by which students, faculty, or staff that is detrimental within the classroom environment, anything that interferes with the well-being of fellow students and or faculty and staff members, anything that can cause damage to the appearance or structure of the college, facility, and or its equipment, conduct by a student who copy or otherwise plagiarizes the assignment projects of another student or professional, and also conduct by students who otherwise display conduct detrimental to their own academic progress or ultimate success in the field for which they are being educated. Students, employees, and guests using Rasmussen networks to access the internet are prohibited from viewing inappropriate materials or visiting sites which have been identified as facilitating the violation of copyright, intellectual property protection, or other suspicious illegal activity. Prohibited materials could include pornographic images, illegal file sharing programs, such as illegally downloading and sharing of music, or other violations of a Rasmussen College acceptable use policy. Violations will result in loss of network use privileges and possibly other penalties. In addition, it could lead up to and including dismissal of the program or college. In addition to the Rasmussen conduct dismissal policy, medical assistant students are also held to conduct standards within the classroom, community, and externship settings. If a student attends a class or clinical site and is in violation of any conduct, dress, or appearance, or behavioral standard, the student will be at risk for dismissal from the classroom or clinical site. Instructors reserve all rights to dismiss students from class and not to return to class until the student is able to present themselves in a proper professional manner that follows the PATH project conduct, dress, and appearance, and behavior standards for both Rasmussen College and the medical assisting program. The attendance policy. Rasmussen College students are expected to be on time and in regular attendance for all of their classes. Medical assisting students are required to contact the instructor in the event of an absence from class. If a student misses a class, he or she will automatically receive a 0 in the PATH project for that class session. A student may not miss more than 8 hours of a residential lab time. If this occurs, They may fail the course and have to repeat that course in addition to the online co-requisite course. This 8 hours is accumulative, so any time missed in the lab is calculated, whether it be full class or partial class time. Confidentiality. Students are expected and required to maintain patient confidentiality. Failure to comply with this policy in any venue, whether in person or online, will result in immediate dismissal from the medical assisting program. All HIPAA rules and regulations should be followed at all times. All students must ensure that they take all measures to maintain confidentiality of all information discussed between fellow classmates, patients in a clinical setting, or within a clinical externship placement. Confidentiality also extends to social media. All medical assisting students must refrain from posting detailed medical information, images, negative comments regarding an instructor, clinical site, or partner, and anything that could be considered a threat or harassing statement on any social network site or messaging board. Our health and safety. Health insurance and liability. Rasmussen College does not provide health insurance for students. Students are encouraged to acquire and maintain health insurance while in the program. In addition, the students must understand that he or she is responsible for any costs incurred if he or she is injured at the clinical externship site. All accidents and injuries must be reported to the student instructor immediately. The instructor will initiate an incident report and follow the protocol outlined in the Rasmussen College Safety Manual. Lab safety practices as taught by our instructor and is mandatory by OSHA and established in the Rasmussen College Safety Manual will be required of all students at all times. Unsafe practices will not be tolerated and may warrant dismissal from class and or the program. Safety protocol and procedures while in a clinical externship laboratory must also be followed at all times. Please review the instructional practice control list in your handbook. For any questions, please reach out to your program coordinator, your instructor, or academic dean for any clarification. To maintain cleanliness of the medical assisting laboratory and to reduce possible exposure to bloodborne pathogens or infectious materials, students are expected to ensure that all equipment and working surfaces of that laboratory must be clean and disinfected at the end of each class session. And now let's talk about the student expectations, clinical hours, online coursework, lecture, conduct, and dismissal in the externship and capstone course. The medical assisting diploma student will engage in an 11-week on-the-job medical assisting training experience in a physician's office, clinic, or medical center. The extern will perform medical assisting job duties in both the front and back office, including administrative and patient care. These areas really help to develop on-the-job training skills. Under no circumstances will the student extern receive any type of pay for the externship hours worked. For a student to be eligible to be placed and start their externship, the following must have been completed. 1, successful completion of all medical assisting diploma coursework except for the externship and capstone courses. They must complete all required immunizations programmatically and any additional required by the externship site. They must complete and have the acceptable background check, and they must demonstrate proficient medical assisting skills, both clinically and administrative, and they absolutely must demonstrate professionalism. Who finds the clinical sites for the student? The medical assistant program coordinator will obtain externship sites for their students. Students do not find their own sites, and all the hours must be completed at the site or sites obtained for each particular student. In regards to transportation, medical assisting students are responsible for providing his or her own transportation to and from the clinical externship facilities and will incur any cost for that. It's pertinent that the students really know that he or she may need to travel a little out of the immediate area to complete externship activities, and the cost of any such travel for that is the responsibility of the student. The program coordinator and externship coordinator will work diligently to try to find a site that is close for the student as much as possible. It is important to know that we are at the mercy of the clinical sites on when they can take students. So with that being said, when we get the list of sites that are available at each campus location, we then place it accordingly based on location as well as what is the best suit for them to ensure their success at that site and potentially, hopefully, possible hire thereafter. Transportation and housing costs during the clinical externship will be the responsibility of the student. During the end of the program, the student will be expected to participate in a capstone course. This course has discussion posts, course quizzes, some assignments, live study sessions for the CMA exam. They must pass this course with a 73% or higher, and the students have to attempt, students only have 2 attempts to pass this capstone course. Also note that there is a final exam in the capstone course, and students receive 2 attempts for this written final exam. That exam must be passed with a 73% or higher to successfully complete and pass the capstone course. Students will also be participating in various things within their externship course. They'll have course discussions, they'll have a few assignments, and they'll have to complete their hours in their clinical externship. Students in Florida, Illinois, Kansas, and Wisconsin will need to complete 180 hours in the clinic, in addition to 20 hours online coursework. Minnesota students, due to their regulations in Minnesota, will have to complete 240 hours in a clinic in addition to the online coursework. Please note that generally most clinical externship hours are Monday through Friday and primarily 8 a.m. to 5 p.m. So you will need to make sure that you are working through this process and have everything lined up prior to the end of the program with your employer that you may have now, in addition to daycare and other obligations you may have to make this work. An average student must work between 24 and 40 hours per week to complete their externship within the 11 weeks. Students only have 2 attempts to successfully complete their externship course. Should a student fail their first attempt and be dismissed from their externship site, the student will get an additional attempt. However, they will have to wait until the next quarter to place their second attempt externship site.
Okay, must stop.
At this time, should you have any questions, please reach out to your program coordinator.
Okay. And I was just saying, we're going to do sign-offs. Do you guys have any questions about anything she went over for orientation? Okay, so again, that assignment is going to be due Sunday, so January 7th. It is going to be due online. So when you go into that assignment, you'll see the Word document again. You'll just be able to fill in your answers there from what you picked up today, okay? In your packet, the next thing that we're going to work with, it says medical assisting programmatic orientation sign-off forms. That's what I'm going to have you guys get out. And we're going to go through these and have you sign them as we go through them. So we're going to sign off on 4 of them: Appendix E, Appendix F, Appendix J, and Appendix K. And these are 2-hole punch, so that means that when we're done today, these are going to go in your folder for me to pick up at the end of the day. So the first thing, Appendix E, is talking about the invasive procedure information sheet. Couple of things. We are obviously going to be doing invasive procedures on one another. You are going to be doing blood draws on one another, injections on one another. We're going to be testing your urine samples and your blood samples. So we're doing invasive things on you guys. By signing this, you are saying that you agree to have those done to you, number one, and that whatever the results are, you will not come back for us if something comes back positive. Let me explain. I had a student who was in one of my clinical classes where we do urine testing and we were testing for pregnancy. She found out in class that she was pregnant, and she did not know prior to coming to class that day that she was pregnant, and then finished her program and sued me because she found out she was pregnant in class and got embarrassed. But this document says that we could do that. So, yeah, it didn't go very far. She tried multiple times, did not work, because she signed this form. So the benefits to you practicing on one another as opposed to dummies is you get what it's like to really do this on real people, right? You get real reactions, you get real results. Where if you do it on simulated dummies, while they give you those real results, it's not the same, okay? But of course, before we do any of these hands-on procedures, I will show you how to do them first, and obviously be watching you do them so you don't injure each other or yourself, okay? If you agree to that, the Appendix F is where you're going to sign off on that. You are going to sign off saying that you have been given the opportunity to understand what specific injection or invasive procedures we are going to be doing. You will follow protocol and instruction on how to do those with little to no risk to your classmates or yourself. And you must have my full attention when you are doing them so you do not injure yourself or someone else. If you agree to that, please sign it, print your name, and date it. And again, today is January 4th, 2024. The next one is Appendix J. That is saying that we went over the programmatic orientation. You attended that, and we went over the handbook. So your name is going to go in that first line. So it says you have received and understand the contents of Rasmussen University's Medical Assisting Handbook. You have read and acknowledged the information regarding the program and the externship requirements. If you agree to that, please sign, print your name and date. And the last one is going to be the HIPAA, programmatic HIPAA and confidentiality sign-off sheet. Again, your name goes at the top. It says that you are committed to protecting the confidentiality and security of patient information. During this course of my program, I understand that there may be information shared to enhance the learning environment, and I will take all measures to maintain confidentiality of classmates, patients, and our medical facilities that will be discussed. Again, if you agree to that, please sign, print your name, and date it. I am going to turn off the PowerPoint at this point because I'm going to have you guys get up here in a minute and let you explore the lab. I'm going to do things a little bit backwards than what I have on the board, just because I want to be able to record that part of class for Alexa, who is absent. So instead of having a gap where she's just like staring at nothing and listening to nothing, I figured we would get up and do the lab tour. So in your packet, there is an assignment that says lab tour and safety. I think it's the last sheet that I gave you in that fun packet of papers. And with that, again, this is something I'm giving you the hard copy, but you are going to be turning it in electronically. And this is also going to be due on Sunday. But in order to do this, you have to be able to explore the laboratory that you are currently sitting in. So what this is it's your way to get up, explore the lab, explore what we have, and find some specific things around the lab. So with some of these, there are two parts. If you notice that there is a column that says yes, a column that says no, and then there's a column all the way at the end for filling in, answering questions. So the first question that you're going to answer is a two-part. You're going to answer the yes, no part first, and then obviously the follow-up question of where is it? So the first one is, where is the lab safety manual? Or is there a lab safety manual? Gave that away, that there kind of is. Is there an MSDS? We actually just call it a material data safety sheet now, so it's an MDS, not an MSDS. Where are blood specimens discarded? This one is not a yes or no, it's just to fill in your answer. So my question is, do you guys know where we dispose of blood specimens? You're just gonna point. I love that. So Shane is just pointing to the white, I'm gonna lower the camera, that white bucket over there. That is called a biohazard container. So anything that is soaked or saturated in blood or bodily fluids is gonna go in there. Giving you some free answers here. The fourth one says, where are needles and other sharps discarded? Where are needles and sharps discarded? You guys know that answer. You can't, it's okay. Fill it out. Yeah, so these are called, funnily enough, called these sharps containers, because why would we go and give them a cool name? So these are called sharps containers. Sharps containers are typically red, yellow, or orange in color, so they stick out for you. They have the biohazardous label on them, and they are very thick, heavy plastic that makes them puncture proof. And they typically either have a lid like this one that will kind of create a backflow so nothing can flow back out, but we can drop things in. So these are called sharps containers. Why would we give them a cool name? All right. Then it asks you, of course I walked away from it right as I went to start talking. Are biohazard containers clearly labeled? So clearly labeled could actually be that they have the sticker on them, or that they just have that red biohazardous bag in them. That indicates that they are also usable, or that they're clearly labeled. So not only are you going to have to answer yes or no that they're clearly labeled, but then you have to go around the room and count how many we have. Look, I already see people like, I'm going to let you get up in a minute and stretch your legs. It's okay. The next one is actually a three-part. It says, are sharps containers puncture resistant? That's a yes or a no. Then you're going to tell me how many are in the lab and where are they located. You don't have to be like super specific, like they're located in the northwest corner of the room. You can give me sort of like basic logistics, like, oh, it's by the phlebotomy station, like the one I just pulled. Okay. Are safety needles used in the lab? That is the next question. And I'm going to give you this answer. The answer is yes. Okay. We do use a couple of different types of safety needles. I'm just going to grab the phlebotomy one because it's right here. Safety needles mean that they have a safety device on them. A safety device is a plastic piece like this that goes over the top of the needle when we're done to lock it in place. That's what a safety needle is, okay? Then it says, how do you close a contaminated needle? So very simply, when we are done with a needle, yes, this is a needle, it's an active live needle. We're gonna say I did a phlebotomy procedure, I stuck somebody with this needle, it's now contaminated. In order to close it properly, what you wanna do is you want to push your safety onto a hard surface until you hear it click. So push your safety on a hard surface until you hear it click. Once it is clicked into place, you can certainly try, but as much as I'm going to try, if I kept trying to bend this backwards, all it's going to do is snap that needle and the whole thing's still going to be covered by this safety. Okay, so safeties, once they are locked in place, do not come back off. Is there a policy? I'm sorry, nope, I skipped one. Are all sizes of gloves available? That's a yes or a no. And then where are they located? There are actually 3 locations, 4 if you want to be technical, where they were located. I'm going to have you try to find all 3. I pointed out 2 of them, obviously the sink and the phlebotomy station, but there's one more location where you could find them. Is there a policy in place regarding when surfaces are to be disinfected at regular intervals, yes or no? And when should they be cleaned and disinfected? Does your laboratory have a written exposure control plan that is a yes or a no, and where is it located? Are standard precautions included in that exposure control? That is just simply a yes or a no. Now, on the back side, because nobody has asked me for this information, or nobody has told me that they need the hepatitis B form, I'm going to give you that answer because I think the first one asks about that, but I have to get it up because I don't know it off the top of my head. So in the event of an exposure or an incident, where would you go for initial treatment? That is somewhere on some form in this lab. I'll leave it at that. And so the second one says provide contact information that your facility employed to give hepatitis B injections. We use Mercy Health. Pretty fun for you. We go to their occupational health building. The address is 3401 North Perryville Road. So I'm pretty sure this is your building, right? Yeah. Okay. It's like, so I'm saying this, I'm like, feel like I'm sending literally them to you. So that's fun. And their number is 815-971-5180. Wow, I had to get really close to see that. Okay. The last 3 questions are your opinion. They're your chance to tell me if you see something. Because if you see something, say something. So the first question says, are there any OSHA violations? OSHA stands for Occupational Safety and Health Administration. That means, are there things that are a safety hazard for you in the lab? Safety being things like tripping hazards, open wires, faulty wires, things like that. The second one says, are there any biohazardous concerns? Biohazardous concerns are things like blood or bodily fluids that are open and exposed. For either one of those questions, if you see something, tell me what you find and tell me how you would fix it. So tell me what you find and tell me how you would fix it. If there isn't any, you can just simply say, I found no violations, okay? And then the last one says, in your own words, why do you think it's important to ensure the lab is clean at all times? Okay. So I'm going to let you guys get up. I'm going to let you explore. Alexa, I'm going to take you on a tour of the room via the camera, so you get to experience this as well. You can work with one another. You can talk to one another, or you can walk in silence. This is fine with me. But I'm going to just slowly take the cart around the room for Alexa, so you guys can get up. We'll let you explore for the next 20, 30 minutes. And Alexa, bear with me as I'm prepping the station to go. I'm going to turn off the camera just for a minute to set that up. All right. So we're going to start you over here. I'm going to go as slow as I possibly can because I know this is going to shake a little bit. So this is just as you walk in the room, these are our exam rooms and exam beds. I'll give you a pan up and a pan down. As you continue around, Show you all of the things that we have. And there's our front door. I'll show you all of the forms. We have the first aid station and the sinks. Got some signage up there, so I'm going to pull back just a little bit again, give you a scan of this area. Ceiling. 4. If you have questions while I'm here, you can ask me. I'm just taking her on a tour while she's not physically here.
Can you refresh my memory? What is MSDS?
So material safety data sheet.
Yeah.
Yep. I'm going to let them finish in that corner and then we will go over to that corner. You can absolutely look in any of those binders over there. Forgot to show you cabinet details. So. All of our cabinets are clearly labeled. Again, I'm going to let them do their corner. We'll go to this side of the room. Here we have our phlebotomy station. So I apologize that glare gets really bad because of the sun coming in there. But this is our phlebotomy station. Our cabinetry here. Chair number 1. And chair number 2. As we come over here, you can see a setup of phlebotomy information on top.
Yes.
That area that you are currently looking at is where we have practice with the phlebotomy station. So those are practice arms first, and then you'll move over to the actual phlebotomy station to draw on live patients or classmates in this case. Let's get a little bit closer to that for you. You can see cabinetry up here. The artificial arms here. As we continue through, some more signage for you. And I was dealing with that device there, that micro hematocrit tubing. It does not, to answer your question. I just happened to hear it, that's why I answered. More cabinetry on top. Zoom into that picture for you here. Give me 1 second. This is our phlebotomy station. So, yeah, injection station, because in their cabinets we've got our needles there. More cabinetry on top. We're going to continue on. More cabinetry on the bottom with some more topics there. Cabinetry here. Cabinetry here. And this is the corner where they were to begin with, so I wanted to just sneak in here.
Yeah, exactly.
Show you. Jeez. You can ask me.
With the biohazard containers,
Yes.
there's 4 white ones, but there's a red one with a red bag.
So clearly labeling, if you remember, I said, sorry, I'm going to turn that off. It either has to have the sticker or the red bag. All right. And, sorry, I was moving that and it looked really crazy on camera and I did not want to make you feel sick watching that. I'm going to just give you the view of the front of the room really quickly. I know you've kind of been looking at it already. But panning to the left side, here is my desk and some additional buy items in the back. Here is the whiteboard. And the scale, and as you continue on, there would be our exam rooms again. Here's your lab tour. I'm going to go ahead and turn off the recording. Please review the email I will send you with more additional information on what you've missed and what you'll need to make up.